name is Billy Lorimer from Miravax in Ireland. I'm very happy to be here today to talk to you a little bit more about the Antera 3D skin analysis scanner. The camera is, we believe it's very innovative. It's a very clever tool. In one very small piece of equipment, you can, as I say, measure texture, redness and pigmentation in one small clever camera. Of course, the very important aspect with the Antera is that it allows clinicians now to be able to measure and quantify the improvement in the skin after any procedure such as laser or IPL, whether that be a 32% reduction in roughness of the skin, a 60% improvement in the variation of pigmentation. So that's the type of information that we can now get, as I say, rather than the subjective analysis, which has been the norm up until now. Over and above being able to measure the texture, redness and melanin, the Antera also has a very high quality 3D feature on it. So that's of particular interest and particularly good feature to use if, for example, that you have a client where you are maybe using fillers or any sort of additional volume products. So they help to show that up particularly well. Miravax as a company have spent many years and a great deal of resource into developing something which is extremely accurate in what it does. We will quote and are happy to quote a 5% degree of accuracy in the findings, but we know and others have shown that it is actually above that. The fact that the Antera is light and portable, of course it means that you can now, you're now able to make an analysis of skin on all parts of the body. You're not just restricted to the face. You can take this to the patient. You're not always bringing the patient to other equipment which may be bulkier and heavier and obviously difficult to move around. So if you are a clinician who maybe moves around from maybe one clinic to another, or you are in a building where you have to move from one room or one level to another, then it's a very simple small briefcase, so it makes life easier from that point of view. You'll be glad to know that although the Antera is an extremely clever piece of equipment, it's simple to learn and intuitive to use. The software is very developed and in fact does a lot of the hard work for you. We have got one especially clever feature in the software amongst many that will actually identify and specifically find exactly the same area on the skin that you measured with your before image. So essentially the software does that for you. We call it spot on, and it finds precisely the same area for you, so you don't have to worry about, well, am I comparing sort of eggs with eggs here? It'll do that for you, and it's quick and easy to do. It's very quick and easy to form a report, and you can print that off and if you wish give that to your client. As you can maybe imagine, being able to put a value onto the quality of the improvement in the skin after a procedure, that's a very nice tool to allow you or your staff who carry out the procedure to actually audit the quality of their work. It's very comforting and reassuring to your clients that they can actually see specific improvements happening. Of course, we're dealing with, or you're dealing with, very fine tolerances, very minor changes in the skin after treatments. So to be able to convey that to a client in a way that both of you understand exactly the same is, I think, a major step forward in the industry. Being able to now carry out a comprehensive but very quick, complete analysis of the skin allows the clinic or the clinician to be able to sometimes even identify other underlying conditions that you wouldn't normally be aware of. For example, sun damage and the like. And in that respect, we have seen in general clinics where they would see on average an improvement of in the order of 30% in revenue from specific clients. Well, you very well might ask yourself, well, how does that fit into where the industry is right now and what's happening in the industry? I think it's very fair to say that the industry in general is moving towards and has to move towards more solid and science-based criteria rather than the subjective, as I say, the subjective analysis which it has been the norm until now. What does that mean for your patients or for your clients? It means that they can understand exactly the improvements that they're investing in, that they're getting value for money, and that they are, you know, when you think about it, they're putting their faith into you to do a good job. So that's important that they get that reassurance. It's also very fair to say that in building that trust between yourself and your clients, that inevitably leads to more work from that person in the future, and it also means that they are going to be a good referral person for your clinic.